It can be recalled that Bauchi State Governor Bala Mohammed was on March 26, 2020, announced as the first index case of COVID-19. Since then, the state has recorded several cases with regard to the pandemic. According to the NCDC daily COVID-19 update, the state had a total of 1,549 reported cases with 1,532 recovery and 17 deaths. The outbreak of coronavirus in Wuhan, China in 2019 came with a lot of misinformation. Being a new disease, rumors had it that it is a laboratory virus that could not survive in places like Nigeria with hot weather. It is a disease for the rich, among others. The outbreak left the world in a race to come up with a vaccine that will help curtail the spread of the virus. When the vaccine was finally produced, Nigeria got its fair share of the Oxford AstraZeneca. The National Center for Disease Control, NCDC, and the Presidential Task Force on COVID-19 distributed the vaccine to states, noting that it is meant for frontline workers that include health workers, security agents, media, top politicians, traditional and religious leaders. Bauchi State received 105,020 doses of the vaccine. Part of the lineup program for its rollout involved sensitization campaign by the State Task Force on COVID-19 across all the 20 local government areas. Other strategies include the involvement of media in developing key messages in their reportage, jingles, and discussion programs. Speaking to some residents, Abdurrahman Bala said the information around the virus and the production period of the vaccine is questionable to him, which is why he rejected the vaccine. He added that government had said the vaccine is meant for frontline workers, so why should they ask us to take it now? To Abdurrashid Saleh, he is a sickle cell disease patient who said he understands that he needs the vaccine but is skeptical about its side effects. A physiotherapist, Najib Sani, expressed dissatisfaction over the process and incubation period of the vaccine. Another resident, Mohammed Inua, said government has not been able to address or react effectively to the rumors making the rounds. Fatima Bello and Grace Daniels all have suspicion on the vaccine.
I feel as an African man, and the temperature of our environment is enough for us to be a little bit immune to the virus.
There is still, an element of doubt, and it could be because of maybe a reaction. Some people react to different issues, and particularly there is need for strong awareness or advocacy as to this vaccination is not going to lead to anything.
I can't give a good reason why I've not taken the vaccine, though I can say I have not even heard of the vaccine is existing.
Despite this resistance, a good number of residents of Bauchi, Ganjwa, and Ningi local government areas had taken their shot. The governor, Bala Mohammed, alongside his executive council and politicians, traditional leaders, were forced to be administered the vaccine. Sani Adamu, Lami Haruna, and Suleiman Umar said they couldn't wait for the rollout. Aisha Bello said as a patient with an underlying medical condition, she was happy that the vaccine came out on time. Speaking on why some people are having doubts on the vaccine, Dr. Ibrahim Egari of Infectious Unit of ATB Teaching Hospital Bauchi said because the disease is new and the race to develop a vaccine has raised doubt in the minds of many. He said even medical doctors are yet to fully understand all aspects of the disease and the vaccine.
Yes, you have to take it from the roots. COVID-19 is a new disease. People don't know about it. It came, it was later identified, the clinical syndrome was defined, and then the causative organism was identified. So it's a new thing. People were scared of it. And then the treatment was not forthcoming. Many drugs were tried and none was successful based on the various trials that were conducted. Then later there was a race to form a vaccine because it is believed by the research world and the scientific world that vaccine will be the turning point in controlling the pandemic. So within that's the shortest time for any vaccine.
Dr. Megari noted that before the vaccine rolled out, it had to undergo investigation by the National Agency for Food and Drug Administration and Control, NAFDAC, who certified it fit for use in Nigeria.
On arrival to Nigeria, we have a regulatory body, the NAFDAC is there. So NAFDAC has to inspect, not just for the presence of anything that is not supposed to be there, like what people are expecting that could be cheap. Definitely there will be no any cheap. But then even the chemical content, they have to verify, they have to ensure that this meets the stated qualities, the stated intentions before they now allow it to be administered on Nigeria.
The COVID-19 vaccine is important for all to take to build community immunity. This report is part of COVID-19 response Together for Reliable Information project implemented by Page Initiative, supported by the EU and Free Press Limited. Elisa Becker, BATV News.